Dr. Cutler, thank you for being here today. We're excited to talk about the research that you have at Heart Rhythm Society scientific session in Chicago. Tell us a little bit about one of the projects that you have presented.
Thanks, Jess. What we were interested in is we've observed in humans that individuals that participate in endurance exercise tend to have, in some situations, an increased incidence of atrial fibrillation. And we don't understand the exact mechanism of why that occurs. So we posed a question of, is part of this related to the underlying health of the atrium, which is important in atrial fibrillation? And so to do that, we utilized an animal model in which a group of animals had undergone genetic modification such that they developed a lot of scar in their atrium, which we know increases the incidence of atrial fibrillation alone. And we coupled that group of animals with a group of healthy animals that did not have scar in their atrium. And we had both groups of animals undergo 3 months of endurance exercise. And we looked at the incidence or the susceptibility to atrial fibrillation in those two groups to see if the underlying atrial myopathy that was present in the animals with scar would increase the likelihood of atrial fibrillation occurring. And what we found was that in those animals that had more scar, that had had genetic modification to create this abnormality, we saw an increase in atrial fibrillation, either with us trying to induce the atrial fibrillation through a pacemaker that had been implanted, or we also, which is a very novel finding and has not been seen in animal models frequently in the past, is we saw spontaneous atrial fibrillation in these animals. And in comparison to the control or healthy animals without any problems with their atrium, we saw a significant increase in that susceptibility. And these findings suggest that the question of why atrial fibrillation is more prevalent in endurance exercise may be more complicated than just the endurance exercise itself, and it may be a marker or a suggestion of an individual that might have some early changes or disease developing within their atria that might make them more prone to these arrhythmias.
So the broader perspective of this is what, in terms of how this relates to potentially for humans?
Well, I think it provides us some important mechanistic insights as to the relationship between exercise and atrial fibrillation that we otherwise could not have understood as well. We also identified some blood markers that suggest changes that might increase the likelihood of atrial fibrillation with exercise. And being able to couple these findings will guide future research in helping us perhaps develop tools that in individuals that do develop atrial fibrillation during exercise, that it may prompt us to look a little deeper and determine are they developing some early signs of heart disease, particularly in the atrium, and if so, look for therapeutic ways to reverse or to manage that at an earlier stage in the game.
So next steps, where would you like to see this go?
So I think we need to continue with understanding some of the underlying mechanisms that are driving these changes. And as we understand these mechanisms with further research, it may identify potential therapeutic targets that could lead to future advancements in therapy. But I also think that we need to move this into clinical investigation in humans to try and determine can these findings be translated into clinically relevant research.
Well, congratulations on your research.
Thank you.
We appreciate you being here today. Thank you.
All right, excellent.